let's move on to now talking about the consequences of bullying, or the outcomes of bullying. So this slide here is really just to help understand research design and how the research, the way it's designed, really informs the type of conclusions that we're able to draw from that particular data. So on the right-hand side where there's the red box, this is what we call a cross-sectional study. So this is where the bullying experiences and, say, the mental health experiences are reported at the same point in time. So the issue with, or the downside or limitation to this type of research design, is that we don't know what came first. It's kind of a classic chicken or the egg situation. The really strong benefit of longitudinal research, so this is more on the side where we've got the green box, is that we can look at the cause-effect relationship. So we know that there's going to be a correlation between bullying experiences and mental health as they're captured at that same time point, but by having a longitudinal study we can actually tease apart that cause-effect relationship. So we have bullying measured at time 1, and we have those mental health outcomes, or whatever outcome we might be measuring, at a separate time point. So this was another systematic review of the literature that we did a few years ago, in which we just looked at those longitudinal relationships, or longitudinal studies only, so that we could tease apart that cause-effect relationship. And what we found was that the odds of future depression, anxiety, self-harm or suicide attempts were significantly higher among those who were bullied compared to those who did not experience any bullying victimization. So this really isolates the risk that bullying poses to the onset of, or contribution to, mental health difficulties. So collating and evaluating all of this evidence is a time-consuming and tricky process, and being able to isolate the effects of bullying. But really what we wanted to do in our subsequent work was to be able to understand, well, how much does bullying explain cases of depression and anxiety in the population? And so to be able to answer this question, we need to know across the globe how prevalent is bullying, and also what's the risk of those future outcomes. By doing this, it really helps us to support priority setting and decisions regarding funding, both at a national, regional level, or even at a global level. So this is the type of data that bodies such as the World Health Organization would be very much interested in. So this is the Global Burden of Disease study, which you may be familiar with. This is the largest and most comprehensive epidemiological study in the world, and it estimates the disease burden of over 300 diseases, injuries and risk factors, and it enables the comparison of the impact of these diseases. So we can actually start to compare the effects, or the disease burden associated with cancer versus depression. And these findings are publicly available, they're updated annually, and we can actually get them to be geography specific, so we can actually even just examine these data for Australia. These types of studies are really important for governments and researchers and other stakeholders that are really trying to inform both health policy and priority setting. And you might say, well, how can you actually compare depression and cancer, given that cancer has a mortality component to it, whereas mental disorders are predominantly impacted by more the morbidity. So it impacts people's well-being to the point at which it actually stops them from being able to engage in activities that they would otherwise be wanting to engage in. So we use this metric called the DALY to be able to compare these two different diseases. So this was a really short way of helping you to understand what this work is really about. And what we were wanting to do is actually to estimate the burden of bullying as a contributor to depression and anxiety disorders. So we did this in the Global Burden of Disease study in 2017, and it was subsequently published the following year. And we needed to have a collation of the evidence on both the prevalence and the relative risk. So we did a very large systematic review of all studies on the prevalence of bullying across the globe, and this is what we found. So when we don't take into account geography, we're just looking at the overall prevalence rate of bullying, we see that's around about 11%. Very little difference between males and females. On the right-hand side, I included the uncertainty intervals. So the estimate is in the red box, but the uncertainty intervals you'll see do overlap. So there really is no significant difference between males and females, and very little difference really between children that are younger or older than 13. When we take geography into account, you can see these different regions of the world. Australia falls into the high-income countries subgroup, and the adjusted estimate there was around 9.5%. You might say, well, that's a bit lower than what you said before, Hannah, and that's probably because we're also including other high-income countries that tend to have a lower prevalence of bullying compared to Australia. So that's why that's a little bit lower. So really what we wanted to then understand was how much does bullying explain cases of depression and anxiety at the global level? And what we found was that across all ages and sexes, bullying victimization is responsible for around 3.7% of cases of depression and 5% of anxiety disorders across the lifespan. When we shrink that down to the age group 10 to 24, this is when it gets much more interesting and those numbers elevate. So 14.5% of the burden of major depression is directly attributable to bullying victimization experiences in childhood and adolescence, and a similar amount, 15.6% of the burden of anxiety disorders is explainable by exposure to bullying victimization, which is really quite striking. If we're thinking about risk factors that we can actually make a meaningful difference of, then maybe bullying is something that we want to turn our attention to in a systematic public health approach. The purple box at the bottom here I've included these as other risk factors that are included in GBD, mainly as a comparison. So you can see there, we can compare those numbers in the purple box with those at the top of the slide. So you can see that childhood sexual abuse and intimate partner violence are really contributing a similar amount of burden to mental disorders as bullying is, which I think speaks for itself. So this particular graph really just shows the burden attributable to bullying across the world. The more blue-coloured countries have a slightly lower attributable burden compared to those that are yellow or red, but really there's largely no significant difference across the globe with regard to how much bullying victimization explains depression and anxiety. So this was the first study to quantify the global prevalence and burden of depression and anxiety directly due to bullying victimization, and it really provides policymakers and leaders in both health and education sectors the evidence needed to justify the allocation of resources to reduce the prevalence of bullying victimization in this age group. This slide really talks about the economic burden. We know there's also an economic burden, and sometimes the economic argument can also be one of weight when we're talking about policy and priority setting. This was work done again by my PhD student, Amazea Jadamba, and she was able to estimate the economic costs of bullying and be able to sort of summarise, how much of our annual mental health budget is due to expenditure that is actually directly attributable to bullying victimization. And remarkably, the end result was that it really explains about 8% of the annual mental health expenditure in Australia. That's directly due to bullying. So bullying, we also know, has an impact on later education outcomes. And this data was a cohort study or another longitudinal study where young people were followed up over a very long period of time. Their mothers were actually recruited when they were in utero, and the kids were followed all the way through to the age of 20. And what we wanted to do here was actually examine what is the association between bullying victimization experiences at age 14 and the education and employment outcomes at age 20. But we also needed to be able to adjust for the potential confounding factors that might also explain education and employment outcomes. And I've listed those in the dot points. So demographics, cognitive ability, internalising or externalising problems, and academic performance in general. So we're controlling for even all of these factors in these results. What we found was that Year 12 completion was significantly lower among those young people who reported bullying, victimisation, victim perpetration or perpetration at age 14. So overall, 19% didn't complete secondary school, but those rates were much higher among the group that were exposed to bullying. When these young people were then followed up at the age of 20, they were asked about what they were doing post-school, and they might be in education, such as university or some other training program, or they might be in employment. If they didn't meet one of those two criteria, they were placed in a group that was, I suppose, classified not in education, employment or training. So overall, this was about 6% of the young people that were initially asked about their bullying experiences of 14. And what this study found was that those who experienced victim perpetration or perpetration of bullying at 14 were less likely to be in education or employment at the age of 20.